The topic is stem cell in aesthetic medicine, and I want to present you a novel technique of, we call it endogenous stem cell activation, which is using the stem cells you have. Just give me a short introduction into stem cells, which we know, what is a stem cell. Keep your seatbelt on, as is written here in Time magazine in 2009, because this ride is going to be wild. And just a short introduction to the history. The French Nobel laureate Alex Carrel was the first one who used cells in kind of stem cells, aging cells. He put them into an embryonic tissue cultivation from a chicken, and then he could have them living over 20 years, which was actually the first evidence that stem cell treatment worked. Later coming in Switzerland, probably you know the Clinique de Paris, the Swiss Dr. Paul Niehans, the son of the German Emperor Wilhelm, who at the end of the day was the first who used fresh cells. These are not so much stem cells. They are, a donor is an animal, and many famous people came to this clinic just and wanted to be treated there. The problem, what came out and comes out in this treatment is always acute graft versus host disease. In these treatments, which use in contrast to an organ transplant, a stem cell transplant is an organ transplant as well, but the amount of cells is much more lower. So this is not so much acute, it's a chronic graft versus host disease and can have severe complications. And we have this from the Philippines, as you used here. 2 congressmen die after stem cell therapy, so it's probably a big issue. And it's understandable. You always create immediately an allergy. I had a very important politician with me the day before yesterday, and she told me she took stem cells, sheep cells, and then she said she doesn't feel anything. I said, normally you don't feel anything because normally the body immediately goes with an antibody creation against these cells and destroys the cells. Because the body does not allow foreign body to come into our body, so it's not possible. The second thing, what we feel when you take donor cells, even human donor cells, is the DNA chimerism. We found that many people who use it after some years, their DNA changed. They have DNA of the donor mixed with their own DNA. I don't want to think about the sheep DNA and our DNA, but actually it is a consequence. We have to think about this. So the only, historically wise, the only donor treatment with allogenic treatment has been done by bone marrow cells, which is, you have to weigh up the risk of cancer, leukemia, for example, and a foreign donor, because they cannot take their own cells. The current stem cell use, what are stem cells, why use stem cells? So you know, just a picture which is very famous, single cell embryo is a so-called totipotent cell. And after 5 to 7 days, we have these embryonic cells from the blastocyst of the embryo, which are pluripotent and are used in some countries. The problem in embryonic cells is clear. It's a high heterogeneity, tumorigeneity, and the teratoma is a classical tumor which may result of this. The second thing is embryonic cells is not immunogenicity, but is an ethical problem for many countries. So then we come to the infant with cord blood stem cells, which is good for their own. If you have a baby, you cultivate the cord blood for the later years if it's necessary for the baby to have this when the baby is adult. But what we have, and this is never so really come through, we have our own stem cell as well. We all have stem cells. I just told you, every minute we produce 2 million stem cells. We have a possibility to measure the numbers of stem cells, which you have. We saw in a big group that only smokers have very few stem cells, chronic smokers, but not normal people. They develop, even not age dependent, the same number. So that's why we don't die so early. That's why we live longer, because we always have repair. Stem cells have the ability to go into ectoderm, mesoderm, and endoderm areas, and that depends. If you take bone marrow cells, you have a mixture of two cell groups, hematopoietic cells and mesenchymal cells. Both cells can actually produce everything from here. You know, if you take cells from the skin or from the fat, you have only mesenchymal cells, which are good cells, which can produce especially cardiac, skeletal, muscle, not so much blood, but nerve tissue and skin as well. So for skin, for example, fat grafts are extremely good. They can be used and can be as filler or for breast augmentation. Special characteristic of stem cell is, first, they have a self-renewal, proliferation. Then, very important, they have an asymmetric cell division. That means when you have the need to repair something in your body, only half of the cells go to differentiate to this part of the body where the repair need is. The other half, you know, will be replaced again as natural stem cells or progenitor cells. So it's always we have these cells located in the niches. They're sleeping in niches, and we need factors to awake them. So when I just give you stem cells, it does nothing. Nothing. It has no effects, because stem cells need an inflammation, a wound. They need commitment factors, where to go exactly, and they need recruitment factors. So what some companies do, just giving stem cells in and out, is not very effective. What is effective in this treatment is the growth factors which go with the stem cells. So stem cell definitions, as an example, here you have the brain, and in the brain we have a layer of progenitor cells around the third ventricle. So every time, when I was student, I learned the brain, once is done, you know? So we lose every day millions of brain cells, and one day we have such a brain. That's not true, because our brain still is good if we are not sick. So we have enough stem cells there, because they're coming up and make our new cells. Two important processes are very important for stem cells. As I told you, the factors which are for the differentiation, regeneration, and factors for the maintenance of the cell pool. The cell pool need to be always the same. So we have factors which are responsible, like TGF-beta and IGF-1, as you know from the growth hormone probably, are responsible for the cell pool, and others are responsible to differentiate into other cell groups. For example, one signaling is for bone marrow cells is angiopoietin signaling. Angiopoietin keeps the bone marrow cells in the niche sleeping. And in the moment there's another factor which inhibit angiopoietin, the bone marrow cells can differentiate, can divide and differentiate. The cell division, if this is a stem cell, this is put into two cells. So one of these goes into the pool, stays in the cell pool. The other is differentiating to progenitor cells, and at the end to the real cell determination where they have to go. Here you see the progenitor cells waiting in the cell area to replace one apoptotic cell. I will give you one example here from a sample. This is a sample of stem cells. This is stem cells 7 days culture without any growth factors, without the factors, and this is with factors. So what we need, actually, we need to put factors in. And here another picture, you see healthy tissue here. This is a tissue, this is after the tissue is injured. There's a lot of damage there. And then we have tissue going with growth factors here in this area. And then we have here growth factors, and then we have growth factors and stem cells together. So it's very important that we have both situations. Stem cells alone cannot do the work. So that's why we do more and more work in this field, and what the novel technique is at the end of the day is what we call endogenous stem cell activation. Professor Bader from the University of Leipzig, who had this patented, He was the first who did a whole liver in the glass outside of the body. So he made a liver, and then he started with other organs. He is very famous now for heart valves and made the trachea. Now he said, you know, the easy thing is, why do I use the bioreactor outside? Why don't I use the body as a bioreactor, which is usual? So what he does is he knows all the factors, just take the blood out, mix it with the specific factors which are for brain, for joint, whatever you need, for skin, and then give it back. The main thing in skin is, and we have just talked before from Altera company, the main thing is you need a wound. If you just make the cells as a cream up, there is nothing happen. The cells only go when there's a wound. So they need a wound, and that's why we have this. Mixes them together in such a simple way, like you see here, spreading them on the matrix, and you can get them over, or you can get them as at least as a gel on the wound. I'll show you now results. So they come home with ultrasound, whatever you used to do. Here again, the injury, inflammation is coming up, so attracts the cells to come, and then they go to repair, go to the crime scene. Here's a picture of a burning patient, and if you remember burning patient with hot water burning, how long in the shower, how long it needs that she is repaired is normally weeks, and she repairs only with scars. Here's the repair without scars, you know, in 6 days. Here's another one which is not so good to see, but you see that it is not so. So that's a smooth where they tried to use a gel on this side. Topical treatment before, you know, this is a very bad situation, and mostly when one of the new students in botulinum or whatever, they used to make a wrinkle here in this area, it's worse. So I saw that in Brazil, and this happened then, and then it heals very good without any scar. This is another one. And here you see a 60-year-old lady with chronic venous ulcer. They tried to work many years on this, and even university clinic in Munich, they couldn't heal it. And this in 3 to 4 months, in 6 days was the healing. Here another one, wound healing. This was the burning of the wound healing, heals without scar in 6 days. This was a kid. This kid had a burning, and this burning was extremely very bad, needed to have a transplant normally. And this is after avoidance of any operation with the stem cell activation. So deep effects here you see is not a nice picture. That's the heel of a diabetic one. So it goes deeper as well. And you see that the healing. This was done months. I know this patient very good in the university in Munich. They did months on that, and here it's very bad. Hair growth, it will be possible as well. This is not our picture, so I just show it because actually you can do everything with this. Thank you very much.